Hello, everyone. It's June the 22nd on Wednesday. This is terrible news, for we've lost 2 more people in West Virginia, but it's great news from the standpoint, it's been a little while since we've had a briefing, and we only have 2 additional deaths. That's surely a positive sign compared to where we've been. Unfortunately, in lots of ways, we lost a 39-year-old female, the 7,017th death, a 39-year-old female from Berkeley County. It's really sad. And we lost a 79-year-old female also from Berkeley County, the 7,018th death. And again, I ask for your prayers. I ask for you just to not let these people feel alone. That's the worst. If you know them, please call them. Please reach out to them. If you don't, just keep them in prayer, and they'll know that too. We have 1,882 people that are active cases in West Virginia, 612 new in the last 24 hours. Daily positivity rate at 9.10, cumulative rate at 8.15. We have recovered cases just under 520,000. 187 that are hospitalized, 22 in the ICU units, and 5 on ventilators. And again, our state is completely yellow and green. We want it to be 100% green, but we got to live with this. We know we got to live with it. And from the standpoint of, I encourage you all the time, take heed to all the information we give you about booster shots. I was with a gentleman that had worked for us for a long time. And I think he's in excess of 70 years old. And he got really sick, and I wanted to check on him and everything, sick with COVID. And I called him up and everything, and I said, I understand you're doing better, and I know it's been a tough go and all that and everything. And he said, look, I would have never in my life, I would have never believed such a thing. Now, this is a tough guy. He said, but I had gotten my vaccines and everything, but I didn't get my booster shot. And I felt like, look, I'm too tough for this thing. And he said, but it almost killed me. And so all I can do is tell you. But if you're out of your window on your booster shot and you got your vaccines and you're out 4 months or whatever it may be, you don't have any immunity. You're absolutely just winging it. And it's not very smart, especially if you're over 50. The vaccine calculator, all the information is there and everything. Utilize that. Utilize our vaccine COVID, vaccine info line. Utilize the free testing. All that will just help you in every way. We have 74 outbreaks in our long-term care facilities, none in the church community, 134 inmate cases, and 21 staff cases. We're in pretty good shape there. I remind you about the rental assistance program for anybody that's renting, any of the landlords and everything. I remind you about the homeowner assistance program. All these are significant dollars that can come your way. If we can get you qualified, if you'll call us, we'll do our best. I remind you about giving blood. Please check with your physician, especially if you've had this dreaded killer and survived it. Please just check with your physician, and then if you'll consider, I'd sure appreciate it. I want to give you a little update. Our consulting work, to try to upgrade and make DHHR better. I promised you we would do that. We're doing it with the McChrystal Group and everything. It's going to take a little bit of time. It's a 17-week process, and we'll include with a set of recommendations to make an informed decision about how to best shape DHHR going forward. So, we've got that in process and everything, and we really and truly are looking forward to their recommendations. This group is very, very well qualified, and they'll give us good stuff. You know, from a standpoint, we have an ambulance reimbursement rate change. This week I've instructed the DHHR Bureau for Medical Services to submit a state plan amendment to seek approval to raise the ground ambulance medical transportation services to 100%. Basically, this will provide 208 ambulance providers with a 10% increase in their reimbursement rates. And you know, that really is a total of $11.8 million per fiscal year. The Bureau of Medical Services anticipates this rate increase by July 1st, just a few days from now. Our unemployment rate is just off the chart great. You know, it just keeps on getting better. I don't know how to say this and everything. You know, we talk about this stuff all the time. This is 8 consecutive state records. This is not like, you know, we decreased the unemployment rate. This is all time in history, the lowest unemployment rate in the state of West Virginia 8 times in a row. You know, I think about Jennings Boyd. Jennings Boyd won 8 consecutive state championships. And I think he won 10, but won 8 consecutive state championships. Amazing, amazing. Truly, from a little town in North Fork, it was unflat believable. You know, incredible coach, incredible man, impacted a lot of lives in a great, great way. You don't very often do something, you know, that is 8 times in a row that we have set the all-time record of unemployment for the unemployment rate in West Virginia. Okay, we've hired a lady, you know, that's going to work with us. Her name is Melissa Decker, and Melissa is going to lead the new West Virginia office that is located in the Hall of States in Washington, D.C., and what Melissa's job is going to be is just what we said just before. Melissa is going to pound the pavement in every direction she possibly can, flip every rock to see any and every possible grant that we can get to the state of West Virginia. You know, it is so important, and I don't care how many times people sit around and say, well, you know, we've got people that are doing this and everything. We don't have anybody that's doing this all the time. And by having somebody that's doing it all the time in conjunction with the efforts that we're making, without any question, we'll more than pay for her in multiple times. And so with all that being said, we're just trying with all in us to bring more and more opportunity and more dollars to West Virginia. So we congratulate Melissa Decker, and I know she'll do a great job. Great job. Today I'm announcing that I have appointed Lori Smith to the new position of State Workforce Resiliency Officer. Now basically what this is just this. This is a coordination person that basically is matching all of the different things that we have going on within our offices and all across the board with the colleges and everybody else. This is a person that will match, you know, training to potential employment, to a need for employment, to all kinds of different things that really and truly will just be the glue that is putting it all together and making it work, instead of it's sitting in one spot and we don't move, and we don't provide employment, and we don't provide employment opportunities. This will really help. So congratulations, Lori. You've done great work, and we really appreciate you. And she brings 24 years of workforce development, job training, and related experience on behalf of the state of West Virginia. I mean, she is absolutely a terrific person. Most recently, she had served as a lead coordinator for Jobs and Hope. You know, I know Lori really well. She's done a great job. We're really proud of her. Okay, on Monday, I declared a state of emergency for Mingo County due to severe weather that occurred down there on Friday, June the 17th. You know, the storm, you know, that went through, we know, caused a lot of, you know, flash flooding, down trees, power lines, all that, road blockages and everything. The West Virginia Emergency Management Division is responding to this event with resources and to help start the cleanup and get the cleanup process done as quickly as we possibly can. We had a big celebration on Monday, on our state's birthday, 159 years. It was neat stuff and everything. You know, a beautiful lady made an incredible birthday cake and everything, and a walnut and blackberry birthday cake and everything, a skillet cake. You know, it was amazing. It was really, really great, and we're proud of her and everything. And Kathy was with us, and we did a you know, a little ceremony there and everything, and she was a big winner, you know, and again, I can't thank her enough for all the great work that she did, and you know, her name's Kim Weimer, and she's from Scott Depot, and you know, she called her recipe Miss Van's Blackberry Skillet Cake. And so it's now our official cake in the state of West Virginia, and I'm telling you, it is flat out really good. And so Kim and her husband was there, and the rest of her family and everything. We really congratulate you. Also, something that is really neat is our tourism department installed 9 handcrafted, larger-than-life, almost heaven swings. And they're located, I want to read where they're located. They're located in some of our state's most scenic spots. Oh gosh, I just saw the picture that just popped up there. But that's Baby Dog on the one. It's at the University of Charleston. They're at Cacapon. They're at Hatfield and McCoy Mountains, Buffalo Mountain Trail, and Death Rock. They're at Fort Borman, Scenic Overlook, Stonewall Resort, Cooper's Rock, Babcock, Wheeling Heritage, and Blackwater Falls State Park. So, I mean, it's incredible work and everything. And they teamed up, and get this, you know, that's a bunch of the kids from the Mountaineer Challenge Academy. You know, they helped us stock fish at Babcock, and they helped install that sign there, and that thing is heavy, and they had to put it in concrete or rock. They encountered and everything. The highway department came out and really helped as well. But those kids are on their way. You know, it is amazing. It is amazing the work that our National Guard and all these folks are doing to help those kids. And they are just wonderful young people that now, you know, maybe had a bump in the road and everything, and now they're getting ready to get off and really get on their way. But what happened in building these signs is tourism teamed up with students, more kids, from the Nicholas County Career and Technical Center to build the 9 super-sized wooden swing sets where you can take a stunning view at the same time, that you're enjoying the incredible swing that those kids built, and we've installed now, and it's just really good stuff. Great work by lots and lots of folks and everything. And the last thing I had was the birthday cake, and I've been through most all that, but First Lady came up with the idea. I congratulate Kathy. It's really good work, and all the people that help Kathy all the time. It was really good. We took in all kinds of different recipes, and then selected what we thought was probably the 6 most interesting recipes. And then we took in the cakes. We did all kinds of tasting. I was involved in that as well. In the judging, we selected this incredible cake, made by Kim Weimer, and so a good day, a really, really good day. And, I couldn't be more proud. It's an incredible celebration. The other thing I surely don't want to leave this out, but a lot of the kids, were receiving their golden horseshoes, and I think we had 200 plus, if I remember correctly, and everything. And there was one of the kids, and they were knighting different kids and everything. And I can't remember this young lady's name and everything, but Kathy says she was one of the kids that was involved in communities and schools. I mean, really and truly. A kid, again, that was probably having some tough luck and some tough stuff. And all of a sudden, here she is receiving a golden horseshoe and being knighted by Clayton Birch, our superintendent of schools. You know, it is unbelievable what work is being done to help our children all across our state. And I absolutely mean this with all in me. If you can reach out and touch a kid and everything and change their life and just have a positive impact on what they're doing, it is absolutely the very thing you should do. I mean, we absolutely owe it to our kids. We owe it to them and everything, and it will absolutely change your life. I've always said the giver is the one that always wins. And they were kind enough and everything to give me, Jeff Bryant, the superintendents recommend, I guess, for an honorary, golden horseshoe. And so they knighted me, and Jeff Bryant recommended me from Greenbrier County, and an incredible letter, and I thank Jeff in every way. I surely didn't have anything to do with asking in any way, but it is an honor that I absolutely will treasure forever. This is all the kids, right there and everything, and all of us together got that incredible picture, and you need to be really proud of the kids in West Virginia. Those kids right there worked super hard, super hard to achieve this, and they have a real interest in West Virginia and a love for West Virginia. It's good stuff. It's really great stuff. So that's all I got. But anyway, thank you, everybody.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. As Dr. Amjad will reinforce, vaccines are now recommended for children ages 6 months and above. We are seeing the movement into the state of the over 17,000 vaccines that we believe we will have in total by the 29th of June. Both manufacturers, Pfizer and Moderna, are ahead of schedule as far as delivery of vaccines. Vaccines are now offered and becoming increasingly available in physicians' offices, to include pediatricians' offices, local health departments, community health centers, hospitals, and pharmacies. Please remember, children ages 3 and younger cannot receive a vaccine from a pharmacy. They have to visit one of the other sites mentioned. Our COVID vaccine calculator has been updated to reflect these changes, so you can use the vaccine calculator to help with calculating the data that you need for your children ages 6 months and above. We continue to engage outreach with medical organizations, to include the American Academy of Pediatricians, State Medical Association, Academy of Family Physicians, as well as the Primary Care Association, which covers our rural and community clinics. So a lot of continued work going on in that regard. We continue to support medical training opportunities, both through live webinars, training videos, as well as electronic and print resources. We have a great team of folks that are working these efforts. There are additional federal committees meeting coming up here, I believe the 23rd of June, to vote on additional recommendations related to Moderna vaccines for ages 6 through 17. If you are, as the flow of vaccines come into the state, it's not going to be uniform across the state based on what those various organizations did in our ordering waves. There were multiple waves or opportunities to order. So if you have an issue, reach out to our COVID vaccine information line, 1-833-734-0965, and they can help you with identifying locations or times within which vaccines will become available in your area. And another bit of continued news is the governor has continued to press us to keep up the effort to educate West Virginians about the importance of the vaccine. And while it was not as good as the last 30 days, in the most recent 30-day period, we had another 4,500 West Virginians actually 4,510, who received their first dose of the vaccine. So we continue to work hard to educate people about the value of the vaccine, particularly as we see these additional variants coming forward. And I believe we will see more coming in the future, particularly around the fall time frame. So the governor continues to press us to do our best to protect West Virginians. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. As General Hoyer mentioned, we are excited about the COVID vaccines for the new age group. Those are 6 months through 5 years old, as mentioned. The two vaccines, Moderna is for ages 6 months through 5 years, and it's a 2-dose primary series. The Pfizer vaccine is for 6 months through 4 years old, and it's a 3-dose series. We want to remind everyone that choosing vaccinations for our youngest age group in West Virginia is very important. Young people still get sick. They can end up in the hospital. So we encourage you to get vaccinated. Even if a child has had COVID-19 in the past, they should still get vaccinated as well. We do know that's important and can help reduce reinfections. The vaccines, as mentioned, we've gotten a few questions. Some providers have ordered early, so some providers might have them. Pharmacies, as mentioned, but of course, pharmacies, you have to be 3 years and older. If you're a provider in West Virginia and have not yet signed up to be a vaccine provider in the state, you can go on our DHHR website under providers and find the link for that as well. And if we have any questions, have a lot of information on our website as well. Thank you.
Thank you, Doctor. Secretary Bill Crouch and Dr. Claymarsh had prior engagements today and will rejoin us next time. We'll now go to questions from members of the media. The first today from Megan Beshara with WCHS and Fox 11.
Hello, it's Megan here, WCHS. Thanks for having me. Got two different questions, two different topics. First, Governor, about gas tax holiday. I understand President Biden's going to be talking with all the governors about possible relief. What's your thoughts on that? Is there, going to be relief for West Virginians, or just what's your opinion on that? And next to Dr. Amjad about the vaccines for young kids. How do you deal with maybe trepidation from parents that might be wondering, if they should or shouldn't get the vaccine for their child? Thank you.
Well, Megan, thanks. From my standpoint, it's just as simple. From a federal gas, tax, the federal gas tax savings that will be passed on or be cut is, I think, 18 cents. And, while we may think, well, really and truly, what good's 18 cents going to do when you've got $5 gas, or in a lot of places even a whole lot more than that? But it does mean a lot to a lot of folks, and we shouldn't ever lose focus with that. Whether it be $25 or whatever it may be, $25 to a lot of folks, we should never, ever, ever lose focus with exactly that. Now, from the standpoint of is this a fix and is this the right thing to do? Of course it's not. The right thing to do is open up our country to becoming energy independent. I mean, it is just as simple as this. I mean, let's just be really fair. Literally, our problem is the supply. The supply of oil and gas and energy is the problem. Energy prices all across the spectrum, whether it be metallurgical coal, steam coal, oil, gas, natural gas, whatever it may be, energy prices all across the spectrum are sky high. How are we going to get that down? We're only going to get it down one way, and that is produce more. That's all there is to it. And when the Biden administration moved in and just cut everybody off right at their knees, whether they be coal producers or gas producers or oil producers or whatever it may be, just chopped everybody right off at their knees and cling to it. They continued to cling to it. President Trump had us on a pathway of energy independence. We chopped our legs off. And now we're going to come with a federal gas tax holiday, 18 cents. We're going to throw us a teeny little bone, and that's all it is. It's just nothing. Now, on the other hand, from the standpoint of the state, it is nothing except there's a lot of folks out there, really and truly, that $25 or $40 or whatever it may be, is a whole lot more than nothing. It is really important. And from the standpoint of West Virginia, where I was, it's just as simple as just this. We got the money to do it. It wouldn't have hurt anything to have done it. Is it the right thing to do from the standpoint of being a fix? No, it's not. It's not the right thing to do. We should keep pouring the money in making our roads better, fixing guardrails and slips and all that kind of stuff. But we had the money, we could do it. Well, really and truly, so I floated up the balloon, the idea. And the legislature stepped in and said, we're not doing it. And I said, well, if they're not doing it, I'm sure as the Dickens not going to call a special session to waste your money. That's all there is to it. So with all that being said, we should never forget that $25 does mean a lot to a lot of folks. And the second thing we should never forget is just how ridiculous. We don't need to be in this position in the United States. We do not need to be in this position. We have so much energy, it's off the chart. But these left-wing nut jobs that are pushing our president, which I really have got a lot of doubt about, really and truly have created this problem and they own it. Now, of all things, what do? Blame Putin? Are you kidding me? Are you kidding me? So that's my comments. I don't know how to be more blunt. I don't know how to be more just telling you exactly what I think. Dr. Amjad, you take the second question, please.
Yes, Governor. Megan, to answer your question about parents who might be hesitant to vaccinate their young children, we want to make sure parents are comfortable and get all their questions answered from reliable sources. So I would encourage parents who have questions to talk to their healthcare providers about specific questions they might have. The vaccines are safe. They've been approved by multiple advisory committees. And also we want to remind parents that children who get COVID, we still don't know all the long-term effects that are happening in adults and even children at this time. So symptoms of long COVID can happen, several months after the infection or even several years. So that unknown as well should be on the back of their minds. It is not something that you want to wait and see. And if we have a vaccine that's available, we'd encourage parents and caregivers to go talk to their pediatricians and someone that they trust to go over their concerns. Thanks.
All right, thank you, Megan. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I just want to follow up on Megan's second question there. Could you guys give us an idea of any kind of, gauge of interest you guys have gotten from parents? We announced this last week that all these vaccines were going to be coming into the state. We encourage people to go ahead and start reaching out to, medical experts. Do we have an idea at this point? Are parents as excited as, officials are that this has finally been authorized? Thank you.
I think General Hoyer, maybe you just jump in on that a little bit.
Yes, sir, Governor. So Charles, in some initial assessments done by our Joint Information Center with the task force and work done through the Public Interest Communications Lab, it looks like a really strong, we're going to go out and get children vaccinated is about 21% right now. There's a large portion of West Virginia parents who still want to understand from a trusted healthcare provider, and that's why you heard me earlier talk about the outreach work we're doing with those medical providers, and we'll be doing a series of outreach with various organizations where parents are involved to help forward that education effort. Thank you.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor, and other folks in the room. I want to circle back to Megan's first question to Governor, because what President Biden is going to do today is two things. He's going to suggest Congress suspend the 18-cent gas tax at the federal level, but he's also going to encourage the states to have a gas tax holiday as well. West Virginia, that made almost 36 cents a gallon. And all of a sudden that starts to add up to real money. I guess what I'm asking here is, do you think the no you got from Speaker Hanshaw and President Blair was a hard no? Or do you think that it might be worthwhile circling back, seeing if there's any interest, given that the federal government appears poised to cut the gas tax? And explain your concern about the roads, because this is kind of contradictory. People want their gas tax cut, but that goes to fix the road. And the biggest complaint, as we all know in West Virginia, is fix the darn roads.
Well, Mark, let me just tell you just this. You know, I purposely floated this up. And the reason I did was because, you know, I was drawing a lot of questions or flack or whatever it may be about, why don't you do this? Why don't you do this? And everything. And really and truly, I'm almost standing on an island. Well, I don't think, and I've tried to explain that as point blank as I can be. I don't think that it is the right thing to do. But when it went from $2.75 to $5 or even greater, you know, there's a lot of difference, and there's a lot of people out there hurting, and we can do it. We could do it. So what did I do? I said, I'm thinking about this. And what I got was, we're not doing it. Okay. You know, end of question. You don't need to call me. You know, really and truly, I absolutely believe we could have done it. We could have done it, and it wouldn't have hurt anything hardly. It's not the prudent thing to do, but we could have done it. You know, we've got this state cooking and producing surplus after surplus beyond belief. You know, there's still always that looming question about, you know, doing things, you know, that you know, can, you know, from the standpoint of cutting taxes, you know, there's a little bit of that, but I think in this situation we could have done it. I mean, that's all there is to it, you know. But I do still believe that fixing the roads is the primary thing that we should be doing.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everybody. A question about the declining number of deaths that we're seeing from COVID. Obviously, that's good news. And just reporting today, only 2. It's bad for those families. We certainly recognize that. Is there a theory behind that? Is the current variant not as fatal? Is it a situation where we have the increasing number of people being vaccinated and boosted, although the numbers wouldn't say that much really at this point? Or is it a situation where people, whenever they do get sick or get symptoms, they get to the doctor a lot quicker? Thank you.
Well, Paul, I don't think they're getting to the doctor a lot quicker. I do think we had situations where our hospitals were overrun, and that made it a lot tougher, you know, in the months past. But this question is really Dr. Amjad's or General Hoyer's. You know, they'll answer it better than I.
Yes, Governor, I'll start. Paul, one reason over the last 2 weeks, and it ended yesterday on the 21st, was the National Health Statistics Center was not, this is across the country, not just West Virginia, was not fully coding all the COVID-19 deaths. So we had stated that earlier, that from, I think it was the 7th through the 21st, there's a 2-week period that all the COVID deaths, except for the ones that are reported on our death reporting forms, there might be a slowdown. So I don't know if we'll see an uptick after, you know, this 21st deadline. But to answer your other question, I think some of it has to do with therapeutics that are out there that are helping some of our most vulnerable population. But I also just want to keep that in mind. We had a 2-week lag where we were unable to get death certifications fully reported. I don't know if Jim has anything else to add.
No, I think Dr. Amjad hit the key point, but in addition, Paul, I think it is worth looking at the fact that 97% of the deaths that occur are still people over the age. over the age of 50, and our vaccine numbers for over 50 and over 65 continue to be strong, and the governor continues to press that. So we believe that the work we're doing related to vaccinations, particularly amongst our older population, are having an impact in helping us. Thank you.
All right, thank you, Paul. Governor, I'll turn it back to you.
Okay, I got a couple things, and I want everybody to really pay close attention to this. But I always listen. I always listen to our experts. And General Hoyer reported earlier that in the last 30 days, that we had given out first doses. 4,510 folks in West Virginia had gotten their first dose in the last 30 days. Now, let's be fair, and let's be really, really, really fair. How many lives did we save? What's a life worth? Nobody can tell me that, can you? Really and truly, at the end of the day, we got 4,510 folks to go get their shot. How many lives did we save? Is it worth it? Is it worth it being here and asking people to consider to go get that vaccine? Is it worth it? Well, of course it's worth it. Is it hard? Is it frustrating? Sure. Should we absolutely, we hope we get more and more and more folks across the finish line? Absolutely. But is it worth it? 4,510 folks got their first shot in the last 30 days. It's good stuff, really good stuff. And the last thing I got is just this. I want to show you this. This is laying on my desk. This is West Virginia's official highway map. And it is put out by tourism, and it is unflat believable. And I'm going to open it up and just show you just a little bit of how this looks. But it is phenomenal. You know, this is really something. Of course, it's got naturally all the highways in West Virginia on this side, all the stuff on this side. But just think just about this. And it just says this right here. It says we have 6 national parks, including the newest New River Gorge National Park and Preserve. We have 1,500,000 acres of parks and public land. We have the greatest density of whitewater and kayaking and rafting in the United States. We have 1,500 miles of hiking trails, more than 4,000 rock climbing routes, 98,000 miles of rivers and streams, more than 24 flat water trails, 1,000 miles of off-road trails within the Hatfield and McCoy Trail System, 35 state parks, 9 forest and 3 rail trails, 130 golf courses, 5 winter ski resorts, and absolutely the best East Coast freshwater scuba diving in the country, or on the East Coast. It is an incredible map that's put out by tourism. They have done an incredible job beyond belief, and I encourage everyone to get this and everything, and it's just more and more good work. Last thing I'll say is just this. How do you think now all these people have just miraculously showed up in West Virginia? All these people that are coming to West Virginia. How do you think that tourism has exploded? Well, it's happened by a lot of people pulling the rope. First and foremost, I believed. And then I surrounded myself with unbelievably great people. You know, Secretary Ruby has done a job like you can't imagine. But people now are flooding our parks. Look at all the great work the DNR did. Look at the money that we put in upgrading our parks and everything. And look at the folks that are coming to West Virginia. We're starting to grow population. A lot of those folks are ending up seeing just how great West Virginia is and decide, this is where I want to live. You know, absolutely, this doesn't happen by just rolling off the log. It happens by a lot of hard work. And these people have done a heck of a job. And at the end of the day, tourism is really on the march in West Virginia right now, and we want to keep it that way. This map is available for free. It's at rest areas and welcome centers, and also I guess you can get it online at our tourism website. So nevertheless, take advantage. Incredible state, incredible people. We just had to tell our story. So thank you a bunch. That's all I got.